Knock, knock. Hi, guys. I'm Dr. Abby Waldman. I'm a dermatologist at Brigham and Women's Hospital in Boston. Today, we're going to address how to treat nail fungus naturally and also address some of the root causes of developing nail fungus. So the clinical name for nail fungus is onychomycosis, and it's caused by common fungus in the environment that's on our skin, and it's super common. Anywhere from 5 to 15% of the population, depending on where you live, is thought to suffer from this condition. And it's common because fungus is common, right? The fungus among us. Nail fungus is most often caused by dermatophytes, particularly one Trichophyton rubrum, but it can be also caused by molds or yeast. So if these fungi are all around us, why don't we all have nail fungus? So you can think of it like other fungus, like mushrooms. So mushrooms like to grow in areas that are damp, wet, they're dark, they're warm, right? You think of it in the woods in a warm area. And that's similar to other fungus. It needs a lot of nutrition, a lot of sugar, and it wants to be in places where it's not being run over by a lawnmower or kids and dogs. So that's the same with nail fungus, in that the common fungi that cause nail fungus want similar conditions. They want wet, warm, occlusive. They don't want people messing with it by washing and taking off their socks and shoes. They don't want to be bothered by the immune system, and they want really good nutrition. They want tons of sugar there. So things that set you up at risk for developing nail fungus are things that put you into that situation where your nail is just a great wooded area, essentially, for the fungi. So those conditions can be diabetes, where you have a lot of sugar in the blood and it's setting up really good meals for that fungus to live on. It can be you're an athlete and you're sweating and your feet are warm and you're in dirty socks a lot, maybe wearing really tight fitted shoes. It can be that you're immunosuppressed for another reason and that you don't have a great blood supply down to your feet, your immune system's not getting down to your feet, and that's common as we get older. And so that immune system's not getting rid of the fungus that's just around, and so it's able to invade into the nail. Or you might be coming into contact with really wet, warm places like a bath mat that hasn't been washed in 3 years, or you walk around barefoot a lot at a public pool, or you're at a nail salon with a lot of exposed feet and shared tools and wet soaking foot baths. So those are the most common root causes for why you might particularly develop nail fungus. So certainly if you fit any of these criteria, kind of thinking about, well, what can I do with my diet to make sure that I'm controlling my blood sugars and controlling my diabetes? You know, how can I get better blood supply to my legs? Wearing compression stockings, putting your feet up at night. Immunosuppression is harder because a lot of times you have little control over that, but certainly other things like changing your socks every day, keeping your feet dry, washing bath mats, not wearing bare feet in public pools, things like that, those are all controllable. So how do you know if you have nail fungus? Usually your nail will become yellow or dystrophic, maybe thickened. It can involve one nail, it can involve many nails, it can involve nails on your hands or your feet. While the diagnosis can be made clinically, if you're contemplating taking any oral medications, it's really important that that diagnosis is confirmed by some sort of test that your doctor will do, where they'll take a scraping or a nail clipping and they'll either check it at the bedside with something called KOH, or they'll send it for a culture to see what specific type of fungus is growing in your nail. So how do we treat nail fungus? Well, just like mushrooms, it's actually pretty easy to kill these type of fungi. You know, all you have to do is kind of kick a mushroom and it like flies out. That being said, just like mushrooms in your yard, it might actually be hard to get rid of them, because even though you can just pluck that one out, it sends out little spores and like 40 other little ones will pop up. And so fungus is similar. It actually can be killed by lots of things, and we'll go over many of them. So if toenail fungus and nail fungus is so easy to kill, then why is it so hard to get rid of onychomycosis? And the real reason is that the nail is difficult to penetrate by any medication, right? It's very thick, it is hard. When you put anything on topically, it's very difficult for it to soak through and get to the fungus to do its job. Even oral medication has a hard time getting through, again, because the nail matrix doesn't have a high metabolism. Usually there's not a great blood supply going down to the feet. And so it's difficult to get the medication to where it needs to be, and why a long course of medication is often needed. So here are some natural and holistic ways that you can treat your nail fungus at home. Okay. My 3-year-old is going to join us. So what are some ways that you can increase the penetration of the nail so that you can deliver the medicine to the area it needs to be, where the fungus is? So the first way that I always recommend is actually just doing warm water soaks. I recommend diluting vinegar and water 1 to 3. So if you use 1 cup vinegar, you're going to use 3 cups water. And you're going to soak for at least 10 minutes, but even up to 40 minutes until your nail is nice and soft. And you'll feel this whenever you've gotten out of a shower or a sauna. If you feel your nails, they feel softer and more mobile than when you've been out all day, right? So the key is to soften the nail. And the vinegar has an added benefit in that it has some antifungal properties. And so that also kind of does the trick of helping get rid of some of the fungus at the same time. Another way, if you don't like the idea of pickling your feet, is you can use a cream that contains a high percentage of urea. Usually urea around 40% is what you're looking for, a pretty high percentage. So you can use 40% urea to soften the nail. So that does the same. You want to leave that cream on for quite a while, at least an hour before the next step. So once the nail is softened, the next step is you really want to thin it. So you're going to get an emery board, a nail file, and you're going to thin it, trying to thin both on the side and on the top, and really try to get rid of some of that thick dystrophic nail that goes along with having nail fungus. In the business, this is called debridement. And just be careful when you're doing this not to hurt or injure the side of the nail, or the perinechium, the area that connects the skin to the nail, because that can be an area that opens up for infection. After the debridement, when you've thinned the nail with the emery board, then that's when you want to apply, and the nail is still soft, that's when you want to apply whatever other medication you're using. That can be tea tree oil, that can be topical over-the-counter fungal like clotrimazole or Lamisil. It can be Vicks Vapor Rub, it can be Listerine, it can be garlic. There are many different things that have antifungal properties, and like I said, most of these fungus are easy to kill. You just have to get to them. If you do this for a few weeks, I promise you that your nails will start to look better. Now, that doesn't mean that they're going to be completely cured. The nail grows very slowly. Normal nail grows out about 1 millimeter a month on your toenails. So even if you're doing everything right, it's still going to take a long time in order to treat your nails and really have them cured, where the fungus is gone and you have normal, beautiful nail that's growing out. So you can use some of these topicals without doing all the stuff I had mentioned before about softening the nail and debriding it. That being said, it's gonna have a pretty low cure rate. So they've done studies where they compared clotrimazole, which is an over-the-counter antifungal, to tea tree oil. And they've shown that there's a 60% partial or complete response with either of them. They're basically the same, but when you actually check to see if the fungus is still there, it's only 10 or 11% where the fungus has actually been completely cleared after 12 weeks. And so making that nail more penetrable to get the medication where it needs to be is key. So how long should you do this? Really, you should do it until a normal nail is growing out. And that can take many months. Like I said, you might notice an improvement right away or within a few weeks, but really for it to completely grow out and become normal can take up to 12 months, because that's how long it takes for a toenail to completely grow out. So it kind of depends on what you start with, how much of your nail is involved, depends on how long it's going to take for it to improve. So be very suspicious if someone tells you that they can completely cure your nails overnight. So when do you need to move on to oral medication? So oral medication may be indicated if you have more severe nail fungus. And what that means is your nail has most of the nail involved, it's been there for a while, resistant to any topical treatments, where you have 3 or more nails involved, or where there's some other medical reason where you would need to take oral medication. The most common medications prescribed for onychomycosis are terbinafine and itraconazole. These are 2 commonly used antifungals. Generally, treatment is at least 12 weeks for the toenails, and it can be shorter for the fingernails. And cure rate is generally somewhere between 60 and 80%, depending on the study, but with a very high rate of recurrence after stopping the medication, with anywhere from 20 to 30% recurrence rate. Important side effects to know about: some of these medications can be harsh on your liver, so oftentimes the doctor might check some liver function tests to see how your liver is doing. Can also have some gastrointestinal side effects, some stomach issues. So certainly make your doctor aware if you suffer from any type of pre-existing stomach issues, especially liver disease. So once you have cleared your nails, whether you're doing the at-home treatment or you end up having to see a doctor to treat with an oral antifungal, the key is really keeping that fungus from coming back. Because again, if you haven't address the root cause of why you were developing foot fungus, why you were developing nail fungus, then it may just come right back. And so doing all those things we discussed, controlling your sugars, making sure to use compression stockings, making sure your feet are dry, changing your socks, washing everything in hot water, bath mats, getting new shoes, washing your shoes, making sure that you can do everything you can so that once you've treated it and gotten this beautiful new nail, that it doesn't become reinfected, because the fungus is all over. It's not hard to come by dermatophytes or molds. Just like clearing mushrooms in your yard, if it's a good setup for them, they're gonna be right back there next week. One comment on laser. Lasers are effective in that they can help with both the debridement process depending on the laser, as well as actually targeting some of the fungus. The most effective laser is one called CO2 laser, which is an ablative laser. And again, it's kind of like filing. You actually like get rid of some of that bad nail, and it can kill some of the fungus. Another laser that's used is ND-YAG. It's less effective, and cure rates for these are somewhere between 60 and 75%. That being said, given the cost of these and the readily available other medications, I usually don't recommend starting with laser as your first avenue of treatment. So aside from doing everything you can to address the root cause, going forward, I do recommend continuing the vinegar soaks maybe once a week, once every 2 weeks, just to kind of wipe out any fungus that's trying to get in, keep your nails soft. Or you can use a topical antifungal or your antifungal of choice and apply to your entire feet, just again to keep that fungus away. Just good hygiene, good foot washing. Again, all these things we discuss will help keep that fungus from coming back to your nail. I hope this is helpful. I'm Dr. Abby Waldman. This is my daughter Elle, who has joined me today, and be well.